What up, everyone? I'm Nekky Jamal, and I'm live, and I'm excited to be here tonight because I get to introduce you to a dude that I knew from dental, like when he was a dental student. Now he's a successful dentist. He's a mentor, and now a busy practice owner of a huge office in Vancouver. He's my sidekick when I teach PRF and atraumatic extraction lectures, and he's a huge part of the Bites implant residency. And he's taught so many of us to be pros at socket grafting. And now he's giving dentists an unbiased view of intraoral scanners and giving tips on, how to dive into digital dentistry, a skill I definitely need a ton of work in. All I got is my iTero scanner that I don't even use. So, without further ado, let's welcome in Dr. Sangwoo Ham. I call him the Hamburglar. What do you think about that saying? You like the Hamburglar?
I have so many nicknames, man. I still think that's a hamster, hamburger, just
Hamster.
I don't know, like a ham. I don't know. All of a sudden, Doctor Kwan started calling me hamster, but Doctor Jin calls me hammy. My staff calls us hammy, and I don't know. Anything that's ham, everybody just calls it ham and cheese. Mac and cheese is another one.
Mac and cheese. I don't even get it, but I love it, man, dude. It's an honor to have you on this live show. I only thought that
it's an honor for me.
3 people would watch this, and it's kind of been fun because people tune in. I guess in the morning, not everyone sees this, and it's been really cool to connect with people. I've been working all weekend. I've been making flap videos, like third molar flap videos. You've seen some of my videos. Ham? Yeah. So I've been making a bunch of flap videos and posting them online on my site. And so that's been really fun to get to, meet dentists around the world and help them with their third molars. But saying you're helping people get into scanners, and you're helping, people like me who have an iTero and I don't even use it. And you're teaching us how to jump into intraoral scanners. So, tell me, man, how did you dive into digital dentistry, man?
I don't know if I'm gonna be teaching you much, but I think we're on the same boat, But first of all, it's an honor for me to be here,
Yeah.
with all the speakers that's behind, like Dimitri, Ho Young, and it's just so much, all of a sudden me popping out,
Dude,
I
I love everyone. I love everyone, man. It's been really cool. Honestly, man, last week, Dr. Shergan, oh man, that guy, he pumps me up. I call him all the time and he gives me advice because I suck at a lot of things, and he tells me, what's up. So it's been fun, and to have Hoi Young, man, that guy's amazing. And same with Dimitri, but saying I can't, this can't be a podcast without you. So I'm happy to have you on, man. But tell me, man, how'd you get into this? How'd you get into this?
It's funny. It has to be a story. It has to be a story, because anything that happens, I think there's a story to attach to.
Sure.
And with the COVID, it's funny. 2019, December is when I provided my first practice, which was taking over Dr. Bernard Jin's practice. For those of you who I'm beginning probably knows, but
Yeah.
it's a pretty big practice, and I took it over 2019 December, which is 3 months before COVID hit North America, right?
Yeah.
And then I bought my second home again at that time. So man, I was in big debt, big debt.
Yeah,
And
it
then
sounds
we
like
had
the
a
bank
lot of
loved you, man.
bank loved me, but then also they chased me down for money,
Yeah.
and then it's funny because and then things were starting up, and then we were having that supply chain problem, and and then we were having problems getting ordering things in, and prices going skyrocketing. And then this guy named Sean came by. He's the one of the key people in Medit, and suggested me to try Medit. And at that time Medit I-500. And I had a little skepticism. It's a scanner. It's like a field where it's like a mystery field for me. It was, I had Carestream before, and I'll be honest, I had a miserable failure with it. Only thing I could make with that, it was Night Guard. I think it was me that was wrong, because some of my colleagues who used them, they swear by it, but
Yeah.
it just didn't work for me. Crown didn't fit, implant didn't fit. Only thing that fits was the surgical guide and Night Guard. That was like a $40,000 scanner that I
Totally
wasted
down
on
the drain,
because I
right?
didn't
Yeah.
but at the same time, I didn't put the time and effort into it, right? So, and I was like, you know what? I trust Sean, so let me give it a try with Medit. I-500 was pretty good, it's I had some doubts, but then I wanted that on the side so that I can scan things for crowns when I'm running out of PBS, And then
Right?
I was
Yeah.
and it was funny. It's quite fun to have some techie stuff. As we all know, we dentists. We buy things for fun, It looks cool. We're gonna buy it. We're gonna try it, and then we put it in the drawer, and then we're all guilty of that, we're all guilty, right? So
Yeah, we
I
probably
find it's
should
gonna be
buy
one of
more
those.
Bitcoin and less dental garbage. Am I right?
Yeah, and or some or yeah, Bitcoin or some stocks. Look at Tesla.
Yeah,
Holy crap!
yeah.
Tesla, Microsoft, Apple. Man, I should have spent money on those,
No kidding,
right?
right? No kidding. Yeah.
But Meta was cheap. Like I think I spent $16,000 on that one.
Which is kind of
It was
crazy
relatively cheap.
because like all these scanners that are coming in, they're so expensive, man. Like one of
Super
my
expensive.
associates just came back from that Invisalign summit and he was like, man, they're saying we need 4 scanners. Like I have 20 ops in my practice. We should get like X amount of scanners per operatories. And I'm like, whoa, that's like 250 grand. And
Yeah.
like screw that, right? Like I'm not paying for that. But like scanners are can be incredibly expensive. So I like that you said Medit is less expensive, but yeah, so tell us. So you're getting into Medit and then what happened?
And then I bought i500, and
Yeah.
then 2 months later, i700 came out.
Which is usually how it goes, right? Yeah.
Oh, I was so pissed. But then they I managed to get a hand on my i700, and I think it was probably the one of the few best investment I had.
Really?
Down to the conclusion, I don't take impressions anymore. For implants, bridges, crowns, even dentures, I actually stick with scan, and it's pretty good. Like, if anything, like I have a hard time getting the fit is so good that sometimes it's too tight. I gotta make my preps a little, sloppy slightly sometimes,
Hmm.
to make it a little bit less fitting. Like but then it does take a learning curve. It does take a learning curve. But the speed is there. But then I know when we talk about online, like, scanners, they talk about how fast it is, how fascinating it is. But reality is, I don't think it's any faster than impressions. If anything, impression is faster in our hands,
I
inevitably.
I 100% agree, and that's why I never jumped into scanning every patient. I still
Yeah.
find that if I'm doing like, an upper 6 implant, I
Mm,
can get the impression coping in there and take a 2.5 minute PVS impression, send it to my boy Michael at Michael Park at EvoCAD Labs,
yeah.
unsponsored, but I'm giving him the sponsor spot anyway because I love that guy. He's phenomenal. But anyways, like man, 2.5 minutes, it's done, and I bet you I can do that faster than you can scan.
No, I can scan
No,
faster.
really?
No, no, actually, but the workflow is a little different, though.
Okay,
You have
teach
to
me, man.
understand.
Yeah.
It's like scanning. Like, first, I was the one scanning the whole thing, take the thing about my album, and said, all these garbage, right?
Yeah.
But then what I realized was that I don't need to do all that. I don't. So when
Okay.
I bring the patient in for implants, I bring the patient, like, I don't bring the patient in. Assistant brings them in.
Yeah.
My assistant scans everything. I do all something else. It's in my second chair. My impression is second chair now. I don't put it in my chair. It's in
Yeah.
my chair, a second chair. So my assistant scans everything. All I do is I come in, take the healing abutment off,
Hmm.
scan the emergence profile, put the scan abutment in, scan body in, scan the scan body. I'm out. That's it.
Hmm.
And scanning scan bodies, trust me, if you take more than 10 seconds, that's too long.
So why
That's
can't
way
your
too long.
assistant do all that?
Because they're not taking out the scan bodies themselves, right? Like,
Oh,
I
okay.
don't think they don't feel comfortable with it. But if they were
Hmm.
comfortable with it, to be honest with you, I wouldn't even take the scan body scans myself.
Okay. Okay.
Like, because the Meta scanner, it has that little function where there's color coding, where if the data is accurate, the color becomes either green or blue.
Oh,
So we know
really?
that it's good.
Okay. Yeah.
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 So it's not just a photo; it's a scan that actually verifies the data is good.
Yeah. Okay.
So I find that, like, my actual chair working time is less than five, like 2-3 minutes myself.
Really?
I'm doing
Okay.
something
Okay.
else.
Yeah. So see,
So
I'm clearly misinformed or a really shitty scanner.
no, no, no. I think it was a good scanner, man. I scanner scanner. Like, I don't think Medit is like the best scanner out there. I honestly don't think so. I think it's like, if when we compare scanner to scanner, I think we're talking like, let's talk implants.
Yeah.
We're comparing Strawman, Hyosum, Megagen, and BioHorizon and Nobel. That's how I feel like when we start comparing scanners. To be honest, like,
Okay.
there's Prime Scan, Trios 3 and 4, like Medit, and there's what else there, like iTero, those, and Carestream. I think they're all pretty good.
Hmm.
I think accuracy, at least the literature supports them, and the users swear by them. So I
Yeah.
think the accuracy is still there, but I think it's the learning curve because, like, the unfortunate part about the scanner is that their scanning technology, how they obtain the data, is different. So unless you learn properly. Like
Yeah.
if you're a Trios user and you start using Prime Scan, it doesn't work shit.
Yeah.
It really doesn't work shit because
Yeah.
they don't count the data the same. So like if you're a tree and if you're a Meta user and start using Trios, it doesn't work.
Hmm.
It doesn't. It's so much slower. So I think it's something that you have to take one scanner and just go with it. But in my honest opinion, if I had to choose, I'd rather have two different scanners than the two at the same time. On my honest opinion.
You'd have, say it again, you'd have two
Like
different scanners than
yeah,
one.
like one at least one iTero for people who are using Invisalign because or Trios
Yeah.
because if for offices who do Invisalign, I don't do Invisalign, so I don't really care. But it's for that use, I think there is whoever wants to scan for Invisalign purposes,
Yeah.
they need some scanners that works with them. But otherwise, man, Medit, it's a cost-effective option. But if you want like that whole ecosystem of CAD CAM, I
Yeah.
think Prime Scan is the best one.
Well,
I don't
can
think we
you
can.
let's back up. I'm starting to get confused here. Okay, so Medit. Okay, tell me the pros and cons of a Medit scanner as you drink your juice box.
Man, this is good, man. Sugar.
At least it's not Milkus, am I
I,
right?
oh my god, that's my favorite, man.
Yeah.
When I go to Korea next year, I'm gonna be anyway.
Yeah.
Medit, I think it's a you know my honestly, I think it's a good scanner.
Okay.
But it's hard to say because I personally haven't tried enough of Trios or other scanners myself. So it's hard to say that other scanners have this kind of big advantage. But at least from the feedback from my peers, Medit is great for techies. Like it has a lot of functions. It's like it feels like an Android almost. They have all this extra features into it if you want to, and if you make it yours, like it's a great tool.
Okay.
But then, but the downside is that at least personally is they don't have wireless yet. That's one thing that's my biggest complaint.
Wireless.
Like
Man,
Trios,
all of my like my Taro it has this massive computer that comes with it. What do you mean wireless?
yeah, Trios 4 has a wireless, so it's a scanner that comes as a wireless, like a phone, you
Okay,
know.
okay. Yeah.
And Carestream just came up with a wireless scanner, so you don't
Hmm.
have a wire. So computer could be just far there, and then you can just bring the scanner in and start scanning the person.
I can
Because
really see the
wires,
benefits of that.
yeah, and
Yeah.
it's light if you have this wireless. I know Medit is making their wireless one right now. I know that as a fact because they
Yeah.
told me. Apparently, I'm their keynote speaker, but I don't even know why. I don't do anything for them.
Well, you're not
I just
selling me on anything right now, man. Tell me why I need one of these because I hear it all the time. Like everyone is really touting these Medit scanners, and I just don't get it, man. Like tell me why I would need a Medit scanner.
I think like if I were to just as a friend to friend,
Yeah,
if I were to tell you to get a scanner
yeah,
for the office efficiency, that's bullshit. I honestly do think so.
yeah.
Because we've been so used to taking impressions that we can take impressions faster than anything. I
Hmm.
I personally think, and to be honest, we're dentists, man. We can take good impressions 99% of the time. Sometimes
Hmm.
it's hard, and but I think scanner comes into I think two to three good benefits
Okay.
in my personal perspective. One is the patient perspective. Patient perspective. Patient sees the difference in you, how the result comes different. Instead of a big mold coming into your mouth, it's just a scan. Like
Yeah,
like it's just wand just shoving around their mouth and it's done.
yeah,
How easy could that be, right?
totally.
Um, that's and then a lot of patients actually are very impressed. I didn't mean to, but that it's becoming a more of a good word of mouth aspect of my practice.
Like my
Like,
dentist is so technologically savvy, and this is the new standard of care, like that kind of thing, right?
yeah,
Yeah,
because it's like because with RTK, like I actually show the patient some of the big cases. Like this is my final result. This is where I'm going to place the implant, and this
yeah.
is computer assist design, and I am doing that as a part of my treatment planning. And the patient sees your work, and it becomes more of a trust, and we get that uh, patient and dentist trust bond,
Yeah, it's that
But
patient perception, right?
yeah, so it really I didn't expect it, but it really came into play for me. That's one of the biggest things.
Okay.
Others, and then for my other thing is that my staff doesn't want to take impressions anymore.
Yeah, yeah,
Holy
okay,
shit,
okay.
they find that it's so much smoother and easier. It's like they don't have to mix the putty or anything on the side. Like they're not busy with the time. scan. You know, they're
Yeah.
not rushed. They feel more calm. Like the workflow becomes calmer, I find. So,
Okay.
but then, but the last thing I find personally is the organization. It really organizes my cases personally, you
Okay.
know,
This is what I
because
want to hear. Okay. So tell me why.
like, because I'm talking more specifically my own practice, which because I have both implant and I do general dentistry and surgical practices. You know, like it's more about 60/40, where 60 of the time I do surgery and 40 of the time I do still do general dentistry.
Hmm.
But when we start doing implant cases, unless you have a specific treatment coordinator, it's hard to organize things. You see. But then when I start using scanner, it basically shows you what case, like what you haven't sent to your lab or what cases you have scanned it just gives you a list of what you have that you have worked up on or you need to
Hmm.
work up on. And then for implant cases, because I do treatment planning through R2Gate, unless that's sent to R2, I know that I haven't done my work properly. And then
Mm.
once that's scanned, then R2 messages me that the treatment planning is complete. So that gives me a good organization. And also, I don't have to keep all that models. You know, when you have the impression you have that model in your box, like it's all in the cloud.
Yeah,
I can
but
bring it up and I can print it
you
every
get
time.
that model when it comes back though.
Hey, but you have to keep it. Whereas for me, I don't have to. I don't need. They don't send my model anymore. I just have the crown come back. That's
Oh,
it.
really? See, I still get a 3D model. Like I still get a printed
I
model.
my lab, they asked me if I wanted it. I said no. You can keep the 3D model, and if I want to, I can always print it again because the scan data is stored in your cloud.
Okay, okay.
So
Interesting,
if you have,
interesting. Okay.
so, so if I don't have to get that all that storage for all my models. It's all in my cloud.
Yeah,
And if I need to print it again, I can always print it again, and
yeah,
it's exactly the same one every single time. And
totally.
if it breaks, big deal. Like, so for me, it's more organization. So I think workflow, it's different. It's not, if we try to use the traditional, what we used to work and try to apply to digital dentistry,
Yeah.
I think it's different. I don't think it's going to work. I think that, and that's where I find a lot of the dentist complains about, like, cause like my lab and sometimes the method, like whoever's selling method, they come to me and say, how do you make it work? Cause they saw the dentist tried it and then they say, this shit doesn't work. It doesn't work in my hands. It takes forever to scan. I'm just taking impression. They just give up. And I get it because I went through it, you
Mm-hmm.
know, but I think it's something that you have to learn and create your own different workflow to make it work for you. And I
Totally.
think that's big.
I hear that. Can I tell you what my assistant just did with an entire box of models?
What did you do?
She didn't know where to put it, so she put it in the garbage. And I was like, that's a smooth move because now I don't have to find a place for it anymore.
Oh,
And I'm like, maybe throw away last year's models,
you,
not this year's.
you don't break those models and get the analog back
Oh,
on?
give
You're
me a
not going to
break,
reuse the
man.
analog, man?
I laugh at people that do that. I'm like, come on, bro. Like, you really got
Oh,
time to
God.
bust up your models or make your poor assistants bust up your models for you, for a dang analog. But
Oh,
anyways,
God.
okay. So you like Medit for that. I have an iTero. You've tried a CareStream before. What did you think of CareStream?
It just didn't work for me. I think it
And why
works
why
great.
why didn't it work?
I actually don't have a clue, but I didn't. But at the same time, I'm on the defense. I didn't try. Like I tried 5 cases, and I didn't bother making improvements.
See, that's
But
the
then what I
ultimate
know,
frustration, though. You're like, I know a PBS works. I can do my PBS impression in 2 minutes. Why, why am I going to be taking a risk? I feel like every time I scan, I'm taking a risk that, like, what if there's like a, a mess up on the computer's end, or it doesn't scan properly, or if there's distortion somewhere? Like, you know what I mean? Like, how
I,
have you
I,
ever had those
I
issues?
think I did. But then what I realized, because when I would talk with the lab, it's what he told me was that there's a default value for crown fabrication from digital
Okay.
default. And then one other thing you have to understand is that impression, we always take compensation for distortions, expansion, and shrinkage,
Mm-hmm.
whereas digital data is not. So even lab technician has to get used to the digital work process because
Yeah.
it's not the same. So there is that what we call calibration period where you have to try a few cases
Yeah. And
and
you got
give
to
a
take
feedback
both,
to your
right?
lab.
Yeah.
You have to take both. It's just it won't work both. If you just go from PVS to scan, it just doesn't work. Like it won't.
Yeah,
At least in my experience. And then, but then unless you're starting off with digital, unless you go through that calibration phase, which to me it was about 10 cases, which
yeah,
is a lot. But at least for me, I find that it's more easier now. Like I rather not take impressions anymore. I really don't.
sure.
I dread taking impressions. So,
Okay,
but
okay. To
unless
each
we go
their
through
own. To
that.
each their own. I like it. I like it. So saying, can you walk me through? Not everyone is scanning, and that's cool too. I have respect for both camps. I do both.
Yeah.
Can you walk us through? If you were scanning like a 4-6 implant, can you walk us through the workflow if you're using your scanner, whatever scanner you're using? What is like?
Mhm.
How do you go through this?
So basically, I'll tell you both one when I first started and what I do now because I
Okay,
think it gives you a transition
sure.
because when I first started, I brought the patient in, I start scanning the whole mouth, and of course the healing abutment's off, and I
Right,
scan the emergence profile, and then that's once that's scanned, I get the scan body, put it in, tighten the scan body, scan the scan body. That scan body part takes about 10 seconds. It doesn't take long,
right.
whereas the one arch takes about shortest one I did was for now, I think was 29 seconds. And
Okay.
the longest one took me was like 15 minutes
So
because
scanning
that's when I
Olympics.
started. Yeah, because one arch, because I just couldn't know how to use it properly, right?
Right. Yeah. So as you
And
know
then
more, you do more, right?
yeah, it gets faster and faster. And then
Yeah.
I scan the opposing arch, and then take the bite and send the patient home. Of
Okay.
course, I put the healing back on, and then that's basically the work process. But now what I do is that my assistant scans everything. All I do is when the assistant's done scanning,
Yeah.
I come in, take the healing abutment off, scan the emergence profile, scan body in, scan body, scan, and I'm done. I don't even take bite because bite's already taken.
Hmm.
Because you can go back and delete the implant area and just rescan that area only, and it works.
So you take the healing abutment off, you scan the emergence. Okay. And then,
That's not,
so you're basically
yeah,
just scanning, the shape of what your temporary or your healing abutment is. And then you
yep,
put the scan body in, which is much
yep,
narrower than your emergence,
yep,
obviously, right? And is it
yep,
usually
yep,
just one size of scan body for all of that platform of implants, or is there like different widths?
yep.
Like we see different widths of healing abutments.
It's at least from what I've used, it's implant specific, and they don't have different diameters because,
Yeah.
impression copings we have different diameters so we can
Right.
transfer the emergence profile.
Yeah.
But then in digital, we can transfer by scanning the emergence profile or scan the temporary, and they can just copy the emergence profile itself. So so you only have one size. That's another benefit. I don't have to take another different multiple repression copies. I only have
Hmm.
two. Two scan
Can
bodies works for everything.
So do you reuse the scan body, or is it like a one-time use?
It's a sterilizable. It's a sterilizable. It can be
Really?
used up to
Okay.
like a couple hundred times.
A couple
So,
hundred.
well,
Wow. Okay. So there's
they
cost
tell me
savings there
100, but then
too,
I
right?
know. Yeah, and then I'm not
Yeah.
buying like 20 impression copings in different sizes. I just only have 2 to 3. That's it.
Hmm.
Like, and then like Elos one, that their scan body, I think they were sterilizable to 100 to 150 times, at least from my awareness. And my Megagen Blue Diamonds, the reusable one, they told me about 100, just over 100 times sterilizable.
Really? Okay.
So
Okay.
so like the inventory got much smaller. Like
Yeah.
and then because they just create one size because they're not dependent on scan body for the sizes. It's I don't have to buy a lot of things. And then another nice thing about like for example trios they have their own scan bodies. When you
Okay.
scan the scan body, they collect the implant data for you. You don't even have to tell them. They have a little
Really?
markings on their scan bodies. Yeah,
Yeah.
yeah, you can sterilize it, and then like if you scan it, you don't even have to tell them. The scan body just pops up as like Strawman 4.1 or it's like
Really?
Hyostin 4.0.
Yeah.
It's sick. Trio scan bodies are sick.
Yeah.
I think their scan bodies are the best. I honestly
Okay.
do.
Okay.
But it's like it's and they're open system too. You can use it in a different scanner. You don't have to use it in a Trio scanner either. So
For
it's
sure.
so I think there's a lot of benefits to it in that sense,
Yeah.
organization wise. But again, it's once you get used to it.
Once you get used, and that's kind of the thing with everything in dentistry. I think once you get used to it. Um,
Yeah.
but saying I want to see your work in action here. So show me a case here.
Okay, I think I have two cases I prepared. It's not as fancy as Hoyang's locator case, Hoyang, or Dimitri. It's not as sick as your soft tissue, so no comment there. um, I'll just go with I think is, is my case up?
Yeah,
I
your
don't know if
case is
it's
up
up.
right now. Yeah.
Yes, so this is a bridge case. It's the failing bridge, as you can see, like it's a big decay underneath. It was a referral from a different dentist.
Okay.
So I just came to me. So I said, okay, we'll take the implants out and take teeth out and replace implants.
Okay.
And then so this one I did freehand. So you can see like I had to do a sinus lift and I put immediate implants, both of them. And I did a sinus lift with a Densubber.
Man,
Some
I
people are
love
fans.
Densabers. Do you like Densabers?
I have mixed feelings. I have mixed feelings.
Really? Oh man, I love Densabers.
I have mixed feelings. I like them from premolars, but molars I like cast more. It's just a personal
Uh,
preference.
Man, I can
But
do a
it's
sinus lift in not even a minute and pack my
but
bone in there and boom, done. You know what I mean?
I know that. I just don't like the feel of it.
Okay, okay, okay.
It's just a
I'll have to give
preference.
you a
I'm not like
tutorial. I'll give you a tutorial.
okay. I'll learn it from you. I'll learn it from you.
Okay,
You
okay.
know. So this is the immediate 2 week post op. I did Densa on both cases. Immediate placement and 2 weeks looks not bad, right?
Mm-hmm.
And then this is the 4 month post op, and you can see the healing abutment and healed, and you can see the emergence profile.
Okay.
And then essentially I scanned it. This is portion of the scan, and you can see the scan body. So that's a merged image of scan body and the edentulous arch.
Mm-hmm.
So that that literally took, I think, I can't remember, but usually there's time on there, but about 6 minutes altogether.
Okay.
And then you get the prosthetic back, just like that. So it's it is an angle screw channel on the premolar, but you place you fitted it and fits perfect. Like it wasn't like as if there was any to create like fitting problem or like path
What
problems or
kind of
anything.
implants were those?
These were Megagen Anyone, Megagen
Anyone,
Anyone.
yeah. See, I find anyone is great for bridges. But then you jump up to any ridge and to do bridges or Blue Diamond and do bridges. Man, I don't know if it's just me, but like, how do
It's
you?
not you, man. It's not you. It's not you.
Yeah, it becomes quite
In my honest
frustrating.
opinion, man, in
Yeah,
my honest opinion, man, if we're doing bridges, nothing beats anyone and House and ET3. Nothing. I think they're
yeah.
the best for bridges. I
I
really do.
couldn't agree more. I couldn't agree
Like
more. I like it.
that 11-degree taper, it's such a convenient
Yeah,
connection
it's
that
forgiving
when you
more
start
than
doing
anything. Yeah,
bridges,
yeah,
it's so forgiving.
it
Like
is.
any ridge, hell, man, it's such a hell to get a good parallelism, and it's Morse taper, man. It's like how are you gonna get that off? Like it's so hard. So
Yeah,
I never tried bridge with any ridge personally. There is a way, but I just
cementing.
it just
That's the
doesn't
way.
work in my head. Yeah,
Yeah.
cementing or like like MUA and all that. It's just not mine. It's just not my thing. And
Okay.
Blue Diamond, I think I am trying it out. So far, Blue Diamond, I am cementing a
Yeah.
few. I did manage to get a screw retained bridge temporary on my case. I don't know how I got it, but I
Hey,
did.
good for you, man. Good.
But I think it's extremely difficult, and but it's where you have to use something called like Vero based, like a Strawman. That's which is like a bridge abutment for Strawman BLT,
Yeah.
because that gives a little bit of flexibility, but it does give the drawback of not utilizing the connection to the fullest. So I think it's a difference in user interface. I do
Cool.
like it far better for single implants, though. I do.
Yeah. No, I totally hear you. I hear that. Hey,
But
Sang,
bridges, man, no.
I really like this look at this bridge here when it's in the mouth. Give me your tips on covering the screw access hole. What do you do?
Oh, I don't do anything fancy. Just I don't use Teflon, but I use cotton pellet in there. I put cotton pellet, and then I try to leave the crown portion as a part of the filling. So I just fill up all the way to the abutment level for the cotton pellet, and then I seal the coronal part with composite. And then one thing I learned from one of my mentors is that before I light cure, I put a Vaseline on top.
Really? Okay.
Yeah, I put Vaseline. Like
Like
when
that's for
we
the
learned
oxygen
basic.
inhibited layer, right?
Yeah.
Yeah, yeah.
Yeah.
Oh,
So I put Vaseline, have the patient bite, open, cure.
Really
Yeah, and then
interesting.
it doesn't stain as well. So like you know how it becomes like staining and
Yeah.
all around it, but I don't get that. So once I learned that trick, so I like that way doing it.
Okay, so say that whole thing again, just so I can just so I get it. So you
So cotton pellets to
screw
the
it in.
abutment.
Okay, go
Yep.
ahead. Yeah,
And then torque it to the recommended value, whatever the implant, and
yeah.
then seal it with the composite. I tend to put it with a bleach shade because I still want to see where the access hole is,
Okay,
in case if it doesn't stain well.
yeah.
And then I put a Vaseline on top,
Before you cure
and
it.
then have to pay before I cure it, and
Yeah,
then patient bites,
yeah.
and then if I don't, and then I just cure afterwards.
Really, and then that's how you get that nice cover, and it doesn't stain or anything. Hey.
I don't know. It still stains a little bit
Yeah,
because
yeah,
it's
yeah.
not fully sealed around it, but then it doesn't become as dark. I
Okay.
find.
Yeah.
So that's how I do them.
Dude, that's a great tip, man. That's awesome. Okay, so
It's
that dude, I think that's a great case. So it fit, no problems. See, I find the same thing, but I'm doing PVS, and you're totally right. Like
I
to
don't think it's
do
wrong.
no, but to do multiple impression, like when you're doing more than one tooth to fit all the impression copings, like it does take more time than if you just scanned it and put it in the scan body. Now, my question is, usually when I put in the impression coping, if I'm doing like a normal PVS impression, I always pinch the patient, always 110% of the
Yeah,
time, right?
it always does.
It
Yeah,
always
yeah, yeah.
pinches. Then you're like, hey, this is going to pinch. Just hang tight. You'll be okay. I'm
Mm-hmm.
not going to freeze you. Do you find it
Mm-hmm.
pinches with scan body? Does it still pinch?
Zero,
Zero. Hey, so
never,
it's a lot more comfortable. Okay,
zero.
that's good. That's good to know. No,
Far comfortable. And then patient finds it. They I don't have to drill through the trays either. I don't have to look for the holes, take that PBS out.
yeah,
I don't need to do all that. I just scan and take them out.
yeah. Man, oh man, the other day I had an old implant, direct implant. I was taking a new impression
Oh,
of, and the PVS got into their impression copings. I didn't have a long screw, so I was using like a prosthetic screw in the impression
oh,
copings, and my assistant was just handing me stuff, and I thought I put the cotton pellet in, but when I like into the impression coping, but then when I put the PVS in, it pushed the cotton pellet down, and I was drilling through the impression coping to try to
oh,
find this screw, and it was just
uh,
horrible. So no,
we
always
all
use
go through that. We all
yeah.
go through
Oh
that.
god. Anyways, okay, cool. So that's a huge win for the scanning camp there. Let's see your next case, man.
This is full digital, so it's I worked it up completely digital, and I don't do full guided surgery because I just don't like the feel of it. But essentially, it's almost a full guide. But again, immediate molar, standard. It's nothing hard in this case. Broken teeth, good tissue. No real huge abscess, so it's great.
Hmm.
So this is what I do. Once I scan, I send the CT scan and scan to the lab, and I get this plan back almost the next day, like
So
next day or the day or
this
two.
is our two gate.
This is R2Gate, and then you can see the position, and then you can see the density, implant, and I personally do find that the guides fit way better with the scan than the impression because whatever reason.
You
So
know what?
it's
I completely 100% agree there. When I
mm,
just started R2 gate, I would just ask my assistant, hey, after you take the CBCT, just pop a quick alginate impression, and then I would send both, and
mm,
none of my guides fit. And when I did
it
get a
doesn't
guide
fit.
to
It
fit,
doesn't
my drills were
drills
way
off.
off, like way off.
Yeah,
And so if you're
yeah, yeah,
gonna
yeah.
do guided surgery, do not waste your time. In my opinion, don't waste your time with an alginate. You have to scan.
Because I honestly agree. Like like I think when we're doing digital, like because a lot of the labs are not doing digital process. Because when you send an impression, they still scan and do it digitally. It's not like they
Yeah,
pour it up unless you're doing gold. So it does make sense that to give them a digital data over an analog data if we're gonna do digital. Like
totally.
so, to me, it just makes sense. It just does. And yeah, this is R2. Like this, it just fits.
Yeah,
It really just does fit.
cool.
And this is what I do for all planning, whether or not if I'm going to do guided or not. Because only reason being is I can see the prosthetic and do truly a prosthetic driven implants. I can see
Hmm.
where the implant should go and plan it. So that's what I do. And that's the immediate post op. After surgery, I generally do first 2 3 holes with a guide, and then I
Hmm.
finish with my just freehand. And that's just my personal preference because I like to feel the bone more.
Yeah.
But there are cases where I like to do full guided too, when I can't, I just want to retract everything, like sevens. But
Right.
anyway, so this is the one, and then
It,
this is
was this a any
that's the
one
four.
implant?
This is anyone again, because Blue Diamond, I haven't done it long enough to say enough cases to show prosthetic and fine. I'm starting to restore my first few that I placed, so it's
Okay.
all anyone for now. So
Hmm.
it's a this wasn't anyone. It was a 4.5 by 10, and then it's yeah, and then Helio abutment I think was a 7 by no 6 millimeter. I think I used a 6 by 5, but it's yeah, this is what I used to use until 5 months ago. 5 months ago. I try to remember when I was that. So 5 months ago. So this is another one. Immediate implant. You can see the soft tissue healing. And then again, this is an impression. So this is an occlusal view of the scan. It's more fidgety because it's a more screen capture of what I did.
Yeah.
It's an orthodontic view of it. But then again, this is the merge file of the scan body and just the impression itself. But you can see the emergence profile that's scanned in, and you can
Yeah.
see the scan body smaller,
Yeah. Yeah. Yeah.
and you get the crown back. That's exactly what you get. Literally zero adjustment. Zero.
Yeah.
Zero. I tried to wipe that blue marking off, but I can still see it. But then it's a zero adjustment once again, and then that's the X-ray too. So it's
Wow, dude, that's gorgeous, man. You should be proud of that case. That's
like
wicked.
thank you. But
Yeah.
it's but like it works. But I don't think I don't think it's any faster. But I do find it more convenient as you get used to it. And
Yeah.
I just dread taking impressions now. So I haven't been taking impressions a lot. And I think for people who are interested, and I think yeah, people have to have some realistic expectations, because I think I do find that a lot of people, when they start discussing digital dentistry, they say it's the holy grail, that's the best thing ever you're gonna do.
Right. Yeah.
And I don't think that's the expectation you should have. I really don't. You know,
Yeah.
it's a it's a I think that's a false expectation.
Hmm.
I think there should be some realistic expectation. There will be hiccups. There will be a huge learning curve, but once you get through that, I think you'll never go back.
Okay. That's awesome. Because the next step from here would be to get into printing and to get into milling.
Yeah.
And honestly, I have no desire to do that. I can see where it would be cool, but I find I'm too busy. Like I don't even want to consider that to
Totally.
add to another thing to my practice. I feel like I got enough going on in the office. Like to add a separate
Totally.
section, I was like, man, like give me a break. But
I agree.
I want to learn about it. And I think that's where a lot of dentists fall into the traps of getting used to what you know and sticking with it. Just like me with PBS impressions with implants. Like I don't always jump into doing digital because it's what I'm used to. But I think if we just learn quick, easy ways to help us improve our efficiency, I think a lot of us would jump on board. And I'm sure you would agree with that. Hey,
I totally agree. I think it's coming. I think but I think there is a huge, huge walls to jump,
there
price
is. Yeah.
point, learning curve, and staff allocations, and even, as you said, printing and milling. Who's going to do it? Like
Yeah.
dentists say it's the best thing to saves money to do it in-house, but who's going to do that? Hire a lab technician
Man,
or
I
do it
barely
yourself?
get my
I don't know.
chart notes done at the end of the day.
Me
Like,
too.
and I'm like, man, I don't want like honestly, one of my biggest barriers to doing surgical guides for dentistry is sending my CBCT to the lab because they're always emailing me,
Totally.
Nekky, send me the CBCT, and I'm like, yeah, I'll do it later, and then I forget for a week and a half, right?
Yeah, then you end
Yeah.
up just doing freehand. Like this works just fine,
Yeah, yeah,
right?
like
But
I'm just gonna do some freehanded. I'll get through it. No, that's
yeah,
cool,
I
man.
could totally agree.
Yeah.
Totally agree.
So, Sang,
Totally
tell me,
agree.
what would you tell the dentist that wants to, whether a new dentist or experienced dentist, what do you tell that dentist that wants to jump into scanning?
Expect learning curve. I think that's the biggest thing. It's not as pretty as you may think.
Yeah.
It's not cost saving. It's not as more efficient. It's just different. I think that's the huge thing that, at least, that I learned,
Yeah.
because you
Dude,
still
I
have to buy
appreciate your
scanning kits.
honesty. I really appreciate your honesty because you hear it from so many salesmen, especially Itero. Like, I think the Invisalign reps they must get massive commission on these scanners because they come to my office and they're like, Nekky, do you even know what you're doing because you don't use this Element 5D? Like, what kind of shitty dentist are you? And I'm like, are you joking me right now? Like, give me a break. And I think that's the pitfall of digital dentistry right there, is the pushiness and you feeling you're not good enough because you don't use a scanner, which I think is crap. And so,
I think it's crap. I
yeah,
think it's crap.
but no, I'm glad to hear your honesty saying I agree. There is a learning curve. I do some cases, I don't do some cases, but it's nice to hear a fresh perspective on that, man. And that's cool. Is there anything else you want to share about digital dentistry for people learning or want to get into it?
I think it's gonna be for people who are interested.
Yeah,
Just jump into it. It's as I said, it's learning curve, but it's fun. It's
yeah,
really fun. Like it's, man, like it feels like I'm doing something different, and I really do encourage people to eventually get into it because it's fun to get into. It is. I find that it's simpler eventually, but
yeah.
that learning curve is huge, and I just think that that's gonna be big, and it is not cost saving. You are buying tips too, okay? Tips are freaking expensive,
Hey,
all right?
tell me, we never even
Holy
talked about
crap!
that. Tell me about membership fees. Like are there
Oh,
yearly
membership fee. Oh,
fees? Because like I know with iTero, there's
uh,
yearly fees plus scanning tips. Like Medit, what is your experience? Do you have to pay every year?
I don't want to say it because I feel like I'm selling now.
No, I would need to know, man.
Well, they didn't have anything before. They just put in a membership. Um, I think it was $1 a month to get a 10
A
terabyte
dollar a
file.
month. Okay, I think we
I
can
think that
afford
was
that. That's fair. But dude,
like it was.
that is fair. That's wicked. But you can't do Invisalign with Medit though, am I right?
No, you can't. You can't.
So you're using another
For
clear aligner
Invisalign,
system.
that's what I mean. Like it's if you're using Invisalign, you either can use only Trios 3 for some countries and iTero. That's it.
Yeah.
Period.
Yeah,
You,
yeah, yeah.
so for people who's using in offices, we're using having Invisalign. There's no point of buying anything else than that. You know,
Yeah.
that's a waste of money.
Yeah. And dude,
But
I think it's kind of cool. Medit charges a dollar a month. I feel better about paying a dollar a month than getting it for free. I don't know
yeah,
why psychologically that feels better because I feel
because
like, they're giving it to me for what it's worth.
it's I think Meta, I think in my perspective, they're really just focusing on selling more scanners than actually doing, subscription based, because that's the
Yeah.
current trend of the business. It's all subscription based, right?
Yeah. Which is
But
annoying.
at least, but then it's just, I think they're not really focused on subscriptions yet. I'm sure because they do have that premium membership where you pay a little more and you get more stuff and this and that, but you don't need it.
Yeah. Okay.
So I think that's a good thing, but I think one day it's gonna come. I think one day it's gonna come. I don't think Meta is one special company that they will never take subscription. I don't think that's not business sustainable.
Hmm.
But at least I do find them quite reasonable. Their customer support is extremely good. Like
Yeah.
my cable broke and my new cable came the next fine. Like they were sent
Dude,
like a few days later from
that's so
America.
important. I love hearing stories like that because I feel like as dentists, we always get screwed. And
Oh yeah, like
it's just one bill after another, man.
yeah, and they didn't charge me. Like I was like, look, I bought your i700 and my cable broke.
Yeah.
Give me another one. Like the next day, they put express DHL and came to like 2 days later
Really?
from LA. Like
Wow.
at this state, like when everything's delayed, it comes the next like few days later. Like I was quite impressed, and their response is quite fast. So I like that. I think Trios is their response is good too as well. But I think it's with anything like even implants. Like we tell people work with a rep that's around you that will work with
Right?
you really really well,
Yeah.
not just buy for the name or something like that.
Yeah.
Medit's great, but if there's no rep in your area, just don't buy it. Okay, get something
No, fair
else.
enough. Yeah. Dude,
I honestly do think so.
I think that's awesome, man. Saying what's next for you? I know you got a big practice. You took over Dr. Bernard Jin's practice. You probably lost half your patients because who can compete with
I know. I
Bernard Jin? I'm just kidding. So, but like, what's your next challenge now, man?
A challenge. I think everything's a challenge.
Yeah.
But uh, I'm just excited what's coming up. Like a lot of I am given more opportunities that's coming. Like I know I know I applied for like MegaGen, what they call Minek Night, which is their
Oh,
speaker
cool.
lineup.
What is that? What
I
does
got I,
Minik Night mean?
Good question. I don't know.
Okay, okay. All right, all right, all right.
It's like a speaker community. So it's that
Okay.
they say I applied, so I applied.
Yeah.
So I think when things are opening up, I'm more excited to see more like, speakers from around the world and learn from them to
Yeah,
be better.
totally.
I'm just more like I'm at the moment where I'm trying to focus on to be better myself. I don't uh, I know I speak for Bites Institute and all that, but I don't have too much desire and fame in anything. I just want to be better. I just want to do something like better for my patients and learn more. And
Yeah,
I'm seeing more opportunities to learn from other people. Like this platform, like it's great to hear from different speakers. I'm excited to hear from other people coming up. Like
totally.
it's really cool to hear. It's and then that's what I'm excited about. I'm starting to learn what my pitfalls, and I'm trying to learn more and be better. And I think I'm just excited for that.
I like hearing that stuff, man, because I think as dentists we all need to grow, and I always ask every single person that comes on here how you deal with failure, because I feel as dentists we all fail, and if you don't fail enough,
We
well, you're not doing it enough. And so, how do you deal with failure, man? Like, what's your go to? I just cry, but what do you do?
uh uh um I do a few things like failure is a failure. Like implant can fail, crown fails, root canal fails. Like and even business sometimes you lose good staff because there's things happen. Um, uh, I don't drink or anything. I'm a boring guy, so I just go play like I just kind of go watch some documentaries actually. So I just kind of be my just kind of lose like just kind of watch something that's different,
Yeah,
to lose my mind off of like documentary or movie something like that,
yeah,
and it really does put me kind of kind of it refreshes me, and
yeah,
then it works well for me. It's and then that's me.
yeah. Do you know what I'm learning? Is every time I start focusing on myself and like feeling
Mm,
like, I really screwed up or I'm not good enough or, why did I even do this case? Cause, I'm not good enough to even pull off the results that, maybe Dimitri or Hoi Young or you would be able to pull off.
mm,
I start thinking about what I can do for others. And I almost put the
mm.
put the onus back on like, hey, I wonder if I can buy someone a coffee today and make them smile. And it almost transfers your mindset, man. It almost is like, hey, I wonder if I can buy lunch for this dude on the street right here that hasn't had a meal. And it almost puts things in perspective. And so
You know
that's
what?
uh, that's what I've started doing, man. And it's
That's
been working
good.
pretty good. Yeah,
You know what though? Because that's funny thing. Because recently, like David, which is the the Bytes coordinator
yeah,
admin, we were thinking about doing, regular like UBC visit, just kind
yeah,
of sharing thoughts to UBC students, and it's that's refreshing because like I went to UBC just recently, just met with one of the few of the instructors, and
yeah,
and then it's refreshing, like something different, and just doing something others, like see what just sharing, like without trying to get anything back,
yeah.
it's
No
just
agenda,
sharing what you
just
do.
sharing, man. Yeah,
Yeah, it's just so awesome. It's a
it
good
is.
feeling,
Yeah,
and I totally agree, man. It's totally agree. That it really refreshes you and gets you rejuvenated.
totally, man.
I totally agree.
Yeah, for all you dentists out there, it's about changing your mindset. And it's about, switching your thoughts from self to service. And for me, that's helped a ton. And that's part of why I wanted to share everyone's story as, we're all dentists in the same boat, but we all struggle. And it's kind of cool to hear how we all can come together. And that's why I started this. I wanted to learn about the people that, continually post their cool posts, but I want to get them to know the person behind it. So I got to well, I already knew you saying, so I wanted the rest of the world to see you. And I'm really happy that you joined us today. I'm excited to see you grow. I'm excited to continue to see your posts on Tuesdays with the TT3
Just
people, and you do your thing, man. You get back out there and teach us, man, because we all like seeing your posts and watching you grow because it helps us grow as well. So thank you so much for joining me, Sang. And next week
Thanks
we're
for
gonna
having me.
no problem, man. Next week we got a really cool speaker, and it's gonna be a surprise. But he's my bro, and I think we can learn a lot
Ah,
about how to treat our patients. And he's
ah,
actually taught me a lot about that, and he's the nicest dude you'll ever meet. So stay tuned. On Monday, I'm going to release who we're talking to, and then next Wednesday, right here on Bytes Global Implant Network. And we'll see you guys soon. Thanks so much for coming on. Hey, hamster.
thanks for having me.
See you, buddy.